our actually we will have. But as you see, if you see, it's like a net. Like a net. At the second level, we have the high resolution and technological capacity. Due to the complexity, here the coverage is less than the percent, but the capacity is higher. Okay. Now, the third level, what is different? The coverage is lower. But here this focus only cases with pathology that requires specialized treatment. For example, this hospital is a step. We here have internal medicine, we have obstetrics, we have pediatrics, we have surgeries, and we have emergency room, and we take care of that kind of simple illness here. But if a patient, for example, is a patient with an ictus, patient with an ictus, we receive it here, but we need to send it to the because we doesn't have a, for example, the MRI.
You want to understand. Repeat what you said.
Stroke. For example, a patient with a stroke. Like a stroke.
Yeah.
It's a stroke.
Yes.
Yeah. For example, a patient with a stroke. We receive here that patient, but we don't have the technology to attend the patient at second level. So we stand into the third level, who has more capacity, more technology, better than this. Okay. And there is, for example, intensive care units, etc., and more. Okay. And the fourth level, here we have the highest technology to attend any patient. For example, a patient with cancer. This level is specialized for any illness or something specific. For example, here we have oncologic institute is the name, that any patient who has cancer just need to be there. And that institute is not an entire public institute. It has some people get money, so the people can be attended there. Okay. For example, for dermatology, have a dermatologist institute that attend only that kind of illness. And we have, for example, a child hospital here who has included a burn unit. That's a full level where you're gonna find all what you need for your kids. Okay. For example, it says here oncology, critical cares, coronary cares, neurology, nephrology, transplant treatment, cardiovascular surgery. Here in Santiago, there's a private center called Health of the Cibao that are just for cardiovascular surgery. When people go, they pay, you have all the service. You have the doctors, you have the cardiologists, you have the surgeons. You can have the labs, and you can be operated. You just go and you out with your problem is okay. That's a full level, and that's different in everyone. Who want to read this? Let's see. Yeah.
If one of these levels is not where it's causing high demand and saturation of the heart.
What do you think about that? What do you think about that? Yeah.
That one.
Yeah. It's supposed to be a network. Works together. At the first level, we attend everything. But if the first level doesn't work, the second, the third, and the fourth level will be saturated. And what is happening in countries like this, not only Dominican Republic, almost all the Latin American countries, this is happening.
Is the problem at the first level?
Yeah.
Usually?
It's a problem of the first level.
We found that you're saying that that's a problem. Honestly, if you're in the US, we have people that go
Yeah.
common cold and, call with an extended wait for people that need that your attention or, those more complex levels of care. So do you think it's a lack of education within the city itself on the different levels? Like, what do you all do to make sure that the public is aware of these different levels? Are those the health promoters' job?
So that system, not the education of people. So like the system. Why? Because
Oh, well, you did say the first one was not really staffed, right?
no. What I'm saying is the fact that the first level doesn't work is not a lack for the education of people. It's a lack for the system. If the first level work, government will spend less money. No. The cost reduce a lot.
So how do you make the first level function the way it should?
¿Cómo tú lo haces que funcione?
No,
¿Cómo tú haces allá que trabaja? ¿Por qué no trabaja?
Having the human resources that needs training, the people who
So you
works,
just need more people to go into those jobs.
yeah, and people who has training. Because there are people, as I was told you, who work as a health promoter, but doesn't have training. And if you have someone working, doing something, doesn't know what to do, that person doing. But what's the other problem? When this happened, a lot of money is spent in health. And more money is stolen by politics. That's one of the reasons.
Can you tell us about like a typical day in your life as a primary care physician, including like some of the most common?
Typical day. Okay. Well, example, we start at 8:00 a.m. 8:00 p.m. You receive the people. We have something called let's see that picture coming there. It's like a record, a family record, not an individual record. Family record, who has all the information of one family. Who is the chief of that family? How many persons? What are their names? Birthdays? Documents, where they live, how is his house, if a good one is a bad one, where is the house, what illness do they have, is any, somebody has hypertension, somebody has diabetes, somebody has asthma. So we collect all the information of the family in one document. Yeah, because we don't have an electronic system. It's like a piece of paper on this dimension that you can open, hold it. We collect all the family information, includes the what level of education it's working, where it works. Do it have social security? Everything, we collect everything. Yeah. Paper. We don't have phones. That's all. We don't have phones. We don't have phone. For example, I received the patients. Take one. We have a patient to see what happened with him. If I need to send him to a second level, for example, to take an X-ray, I made the prescription and made a referment paper. Handwrite. Give it to the patient go to the place. Because we don't have a communication system. Right? The government is working in a network to do that, but still improve. It's still growing. It's not working like we want.
So it's like the ability to measure
Yeah, for example, what we do, we take the patient's information. If I, for example, if you are my patient and and you want, for example, I need you to have an X-ray and some labs, and I told you, go do this and came to me in 3 days. I take your number. I have to call you for my number. Tell you, hey, remember me. I'm waiting for you this day. But in every center, we don't have a way to call you. We need to use our funds. Yeah.
And if I don't want to refer you to that, right?
Yeah.
What if I have automatically go back there? Can I do that, or do I have to?
That's what people do. The people don't people direct to the next level. But for example, maybe you can have your problem resolved here at the center, but people go to the third. So the hospital of third level in this country are saturated. Why? Because second level doesn't have enough resources, and the first level doesn't work.
third level expectation.
Right now, the system is working, trying to introduce the documents for reference. So people need to go to first level to have attended the first level. And if we saw that it really needs another level, we refer. We are trying to work on that right now. But as I was telling you, it's not just the education of the people, it's the entire system we need to be improved. And for example, what we do at the morning, we take care of the patient into the center. We take those documents, those familiar documents, and for example, is Rudy came to me, and for example, he has hypertension. He came to the center, he says his number, that every document has a number, identify any family, and maybe his family is the number 15. Go, my record is the 15. We take the record where we have all the information of him, his family. We take care of them. It starts with the consultation. Okay. Take we have to weigh how high is he, and we take the vital signals and make the consultation. And for example, if he takes any drugs for his illness, we prescribe it and we get him the medicine for 1 month. He doesn't need to pay. If he came here, the second level, it's the same. But when the physician prescribes drugs he needs to buy it. Because second, third, and fourth level doesn't give any drugs, only the first. Yeah.
And they have to go to
For example, there are some pharmacies called popular boutiques, like popular pharmacies from the government, where you can receive the drugs with cheapest price. For example, in front of this hospital, the same hospital, there is a window, and the people go out to every council and go and buy the drugs for our lowest price. What? No. For example, the first level, the fourth level, if you have cancer, you will get everything there. You get the drugs there. Yeah. Oh, that's what I was. But for example, there are some kind of drugs that are real expensive. You need to buy it. The government, yeah. The government doesn't cover it entirely. So the IV drugs. Yes. Yes. What level? Third. The third level. For example, we have here 2 hospitals. One called Jose Maria Cabral Baez is the biggest one for this region, and another called Presidente Estrella Ure. Those 2 are third level. You have and the child's hospital, who works like a third level, but it's must a 4th level. those have a lot of things, you know. And for example, that's in the morning. In the afternoon, at the afternoon, we take every family file. For example, we look people with hypertension, diabetes, asthma, people with maybe any amputation, people who recently had surgery, and we take the file, we choose a region, and we go to visit people who can't go. Listen, you know, that's something we do at the yeah. Well, I need to have a permission to describe it. But I can do it, I don't have it in there, because people need to buy it. This, for example, is a first level center called Centro de Primer Nivel Platanal. First level Centro de Platanal. Here, provide essential assistance made available to all individuals and families in the community. That community is at the south of this province, outside. And for example, they doesn't have any labs, they doesn't have x-rays, they doesn't have dentists. And people need to travel to a hospital to get those services. This one, for example, is where I work. It's a first level and diagnostic center. Here is supposed to have labs, x-ray, dentistry, labs, x-ray, dentistry.
right.
Yeah,
Right.
x-ray. But for example, we start working just with labs. Right now, we don't have any of that. Because we don't have equipment. Well, if I need x-rays or labs for a patient, send it to another center. For example, I need to send them here to the center. So they came here to have his x-ray, to take the exam for the labs, and then go back. It's like 45 miles from here through the month. The government supply. Exactly.
The reason they haven't provided that is due to why haven't they provided that? If that's something that's been prescribed and said about, is it due to lack of funds with the government?
Well, really, I can't really answer that. Because we have, for example, here we have years waiting for that. And always that when we get this, get that, just wait. So we don't know why we don't have the entire service.
Are you aware of Project Cure in the United States? Project Cure,
Yes.
that I wondered if you could get equipment, Project Cure, for your facility. They're shipping a 40-foot container of medical equipment
Okay.
for the children's center, and they will do that for facilities like yours.
Okay.
Would-
So I need to.
Yeah.
Yeah. The programs, they are first programs that we provide at the first level attention. Prenatal care, just the prenatal care. And postnatal care. Prevention of rheumatic fever. We're still fighting here with rheumatic fever. Comprehensive treatment for children since the birth, including the adolescents. Sexually transmitted disease, including the HIV program. Family planning, malaria, expanding program of immunization for children and the elderly, school health. We, for example, one of the things we made at the afternoon, we go to schools and we do some courses for the child, for example, how to have a healthy food, how to do exercise, what to do with the trash, how to prevent the pregnancy. So talk to them about the sexually transmitted disease. That's why we do that program. That program, School Health, is about that. Treatment of hypertension, prevention and treatment of diabetes type 1 and 2, prevention and treatment of tuberculosis, prevention of cervical cancer. We take we make the pap test, and we send this to a lab, and we get the results, and that's how it is. This prevention of cervical cancer work. If we found some woman with maybe a type 1 cancer, we need to send that to a third level or a second level like this. The gynecologist to take care of that patient. When they receive the patient and take care of it, then they took back to the first level. Yeah.
So like in your clinics, are you equipped with all the medicines to treat tuberculosis, type 1 diabetes, like these things that
Yeah.
are more complex?
Yeah. For example, I have right now I have 103 patients with hypertension and 48 with diabetes. And I give them the drugs. Many every three months. The ones that are okay, but ones that always get the high levels, I say them every month. I give them the prescription, and they get the drugs. The infrastructure came with the outpatient clinics, emergency room, respiratory disease office, immunization office, and waiting. I have all that myself, but I don't have the entire equipment. I don't have the human resource for that. That means that most things that we need to do with patients, I need to do it, or maybe a promoter or another one. For example, I have there's a woman who cleans the center, And she has learned, for example, some promotional health skills, because I don't have. The portfolio service, medical consultation of family medicine and general medicine. Psychology, I have a psychologist. Nursing, I have one nurse. Services such as cures, injectables, and for example, and care of pregnant women, prenatal education and postpartum care, attention to minor emergencies and provides support care on first aid, early detection of cervical cancer, early detection of breast cancer, and early detection of prostate cancer. Preparation, control, and follow-up of the healthy child. Family planning. We have everything for family planning. We have pills, we have injections, we have the implant. We have everything that serves. Home care for terminally ill patients and or high risk elderly. That's what we do in the afternoon. We go to the patient house, take care of them. Home care for people affected by chronic problems, malnutrition, hypertension, diabetes, asthma, heart failure, ischemic heart disease, and others. But those are the patients who can't reach the center. And you can see maybe they are amputated, or maybe they are sick. For example, that one was amputated, but maybe is frustrated in the bed and can't get to the hospital. So we, the hospital, take the file and go to his home to take care of them. Care for those affected by serious infections, tuberculosis, HIV, AIDS, malaria, others. We have no, we have that. But that's an interesting question, because not every center has it. And what we need to do, for example, when we get a patient who we suspect has tuberculosis, we need, for example, to take the scoop. We need to go out. We need to go out center and say, thank you, take this and just swallow it. But we don't, we've got most center doesn't have any to have like, yeah.
But pharmacies, they have antibiotics.
Yeah.
So they don't have to do
No, we have that.
they can also get it.
Yeah. And for example, if you get a patient with tuberculosis, we have the program have many files to get the patient's information. So I send that to the office of the program, and they give me depends of what kind of patient is. They give them the prescription and take it to the patient. So I don't give it all the pills. I need to see the patient taking any pill every day. And we told them, well, you came here this day, this day, this day, and we will call to your house in the drug this day, this day, this day. When we go to the house, we saw if maybe the family has infection. We saw the house and tell them what to do to prevent older people to be infected. And that's why we have those cares. No.
And last question.
Yeah.
With the HIV/AIDS, is it only
No, prevention is treatment. But the treatment, we don't have treatment centers. There are some centers called, ¿cómo que se llama? Los centros de VIH. Los site. Site.
Y el de-
Ese program called site. Where we get the people, for example, I have a patient, I prescribe the lab, and the patient came with HIV positive. I refer the patient to that unit called site, where they take the patient, look at the prescription, evaluate the person, and then give the medication. And the patient needs to go every month to that place, but need to be in the primary care center. And that makes the thing a little different because, for example, as I told you, I am maybe 4 to 5 miles from here, and here there is a site. And if I get in that month a person with HIV, need to travel here every month, they go to his house, they need to be at the primary care center. Yeah. Minor surgery. Prevention. Prevention and health promotion. Yeah. Repeat it, please. I can hear you. Yes. Yes, but we need to refer that patient to another level. And this is just a sample of what we do. For example, patient with hypertension and diabetes, these are students of medicine who work at the primary care center. For example, with Dr. Hussein, he is a professor of the Servicios de Salud, and he worked with the students, taking them to the primary care centers, and they do a lot of things. The drugs, for example, for cervical cancer and breast cancer, here the students are teaching the patient how to prevent, how to evaluate themselves. Here too, and this was the World Breast Cancer Day. We do some activities in the community. Here the expanded program of immunization, taking the vaccines to the children. Collective health, that is the work in the community. We take the personal, these are students, medicine students, who go to the community and they participate with people. Depending what we want to do, if we want to talk about the trash, about maybe the cervical cancer, about breast cancer, about hypertension, about obesity, about nutrition, we go to the community and we interact with people trying to teach them how to be healthy. With the older, we work with them too. Sometimes, for example, here, that's the Dr. here. And that day that was a wheelchair for that old woman. And so they get a wheelchair to that woman to programs with the government social security or the NASA, that the people who needs and have this security, they can give the wheelchairs, can give, for example, pampers, diapers, gloves, beds, position beds, some. The visits in home, for example, those are students visiting that house, visiting the patients and looking for the information of any file to see if something new came to the house, is something left the house, is something get another illness, and things like that. Some activities at the school with the kids.
Like today, like the top right, do they do forensic medicine through the school? They do that in certain areas?
Yeah. They do that.
Like, and
For example, activities with children. For example, presentations to how to have a healthy food. Sometimes we get vaccines. We detect children who has vaccines. They go there. And talk, for example, parents about the nutrition of children, with the teachers about primary care at the school. Something happened. If you have a kid with a fever, what you have to do, what you need to do, things like that.
they ever do anti-parasitic medicines or vitamins or other services?
More activities at the school. For example, is a health promoter. Okay. And they used to that was oral health activity at the school. And they gave brush and dental care. That are two students of dentistry, and they made some activities at the school of dentistry to make some cleans, oral cleans, and some things like that. Family planning. Esos son debe ser bueno. For example, these are students from ECU, a program with the university who came like you from United States to an interchange with the university here. The doctor will work with that and do that kind of activities to tuberculosis program. These are activities to prevent tuberculosis and visiting the patients. Those are two students going to the community to see if there is someone who has a cough from 2 weeks or more. If you have anyone who has cough 2 weeks or more, you need to think maybe it's tuberculosis. And have weight lost in 1 month, you need to think it's tuberculosis, and that's what they are doing. His doctor in a sexual transmitted disease activity, she was assisting that patient who has a past back test exam. Antenatal care to the pregnant children. Sometimes we can get some toys to give the children. And this one is an activity about diabetes, a diabetes walk, where we call the people of the community to have a walk to think about do exercise to prevent the obesity and to be healthier and not get the diabetes. And that was it. All right, students. That we used to call when you make them stagnant. If you have any questions, any other questions? Yeah. So I can ask.